Okay, start.
Lie down, relax. Good morning. We are here to wake up Jonathan this morning. The first things we are going to check is his urine. So we should look at his urinary bag. Cut. First, check the urine amount. This way here. Average should be between 600 to 1000 cc's. And we'll check Jonathan's position. This is the way we try to set Jonathan before go to sleep. The foot and ankle area be sprinted so that we will not have the drop foot. The left foot, unfortunately, we have to cut the Achilles tendon, so it is just protected with the pad, just so would not be hit by the sprint of the right foot. Before sleep, we always padded the pillow, just so at the night time when he had the spasm, will not hit the bed or hit each other. In the morning, when you first touch it, it always get the spasm like this. And this is what we would like to stimulate it and let him spasm. The position like this actually is very good, since the pillow, everything is still all in position without being kicked off. That means last night he slept well without too much spasm.
Okay, that's good.
And after checking the position and stimulate the spasm, we will start moving away the pillows, the padding pillows.
Should we take one of the arms? Want to show the arms? Show the arms?
Yes. Then this is how we usually padded the arm before sleep, especially the right arm, the right shoulder. You have quite spasm. So we always bent the arm, the elbow joint, and padded with a towel in between the arm and the chest. And the hand wrapped with this sponge in hope to keep the gripping position. But most of the time by now this usually dropped at the night time. When morning it's always lost it. But before sleep we always still intentionally to do this.
can stop for a little bit and
Okay.
After removal of all the paddings, this pillow, we usually left it at the last before we remove it, and then we will be start ranging. Range of motion is the most important rehab for Jonathan. We always do it very diligently. In the morning, do it once. In the evening, before sleep, do it once again. Range of motion, we start with right upper extremities and then lower, left lower and left upper. So it's a circle. After finishing the extremities, then we'll start the massage from the neck, chest and then abdomen, and that completes the whole range of motion, and usually take about 50 minutes to 1 hour. Each extremity usually is about 10 minutes. We start with the bigger joint. It is important to move the joint we use the left hand to support this joint at the right shoulder, and the right hand and arm support the right elbow joint into a 90 degrees position, and then start moving to up to 90 degrees of the right shoulder. So it will be forming 90 degrees, 90 degrees movement. And this movement, extending the right shoulder, and at the same time use the left hand and thumb to hold the shoulder, support it so that it will not be pulling the shoulder joint out. So the movement like this, approximately 20 to 30 times. After this movement, then we will be moving the movement to forward, and the ideal movement will be the hand to touch the forehead, and again the left hand supported the joint. straight, and then back, again 20 to 30 times. This two directions finish the range of the right shoulder. Then the next will be the right elbow joint. Elbow joint will be moving, start with straight and then bend down to feel is it tight to this angle, and again the left hand supported the left elbow joint. That, and this forehand position, he has already these pronation contractions, so we'll try to do as supinations. This movement, watch the movement like this, or that, and that. Again, 20 to 30 times until you feel somewhat loose position. After this, then the four hands range of movement, that is again the left hand hold the left elbow, and then this forehand portions muscle, we will do this supination position, turn it, little stretch, and then back, stretch, and then back. This is to stretch the spination muscle. Again, 20 to 30 times. After this elbow joint and forehand muscle, then we'll come to the wrist movement. The wrist joint, usually we put it in pronation position, and then use the right hand here, and again support it with the left hand, and then do this movement almost up to 90 degrees. This movement. Again, 20 to 30 times. With the thumb to thumb position is the best, and to hold it this way. After this, we'll be ranging the hand joint position. This hand joint, just think about, make the fist and straight it. Make the fist and straight it. So we will be making the fist for Jonathan, grasp it and straight it. Grasp, make a fist and straight it. Again, always with the left hand support the joint. So by this movement, make the fist, it will be moving this joint, and this joint. So this is metapharyngeal joint and interpharyngeal joints. After this movement, I added with this movement is to stretch these small interossei muscles. And the movement is to stretch it open, put it back, stretch it open, put it back, and it is like we stretch our hand open, like hand open and close. This movement is to exercise these small little muscles. Of course, we will have that thinner muscle, this prominent. He has this already atrophic, but this is already 15 years like this. It's actually is not bad. So this depends on this movement, and each finger stretch it and put it in, stretch, approximate, stretch, again 20 to 30 times. After this is done, then this upper extremity will finish the range. Cut. Next, we will be exercising the right hip movement. Before do this, usually after one night sleep, the muscle is rested, and this is so easy to get spasm. So before do that, usually try to move, stimulate, and he will be kicking all around. And after that, then usually the leg will cool down and will be able to start do the range motion. The joint, we have to think about we walk. So the first thing is to flex the hip, and then we walk, we straight and then walk. So think about that movement. You'll be able to do, first thing is to flex the hip. By flexing this, actually it's exercise all three joints: hip joint, knee joint, and ankle joint also. So if you hold it by this position, then you will be able to move and range all three joints. Straighten, so it will be a little bit more than 90 degrees since it flexes as much as you can, and the knee joint also. At the same time, use the right elbow. It will be doing the ankle joint movement. This is the movement most important. And do not do it in the outstretch this position. You have to do it like you think you are walking and you are bend it yourself, and that's the position should be aligned like that. And this is the movement. Usually you will need to do about 40 times because the muscle will be resist you, and you do need to use some force to push it. The first few times usually it's very stiff, and I mentioned about 30 or 40 times is by that time you will feel loose, just like in the morning when you stretch yourself. At first it's very tight and slowly get loose, and this is the important movement. After this, actually this will be doing all three movements. So we will be complete that, and then the next movement it will be for the ankle joint. This is the one to prevent drop foot. So we have to hold the ankle and push the foot up. At this time it is about 90 degrees like this, and has to be quite forceful, and you will feel this Achilles tendon actually resist you, and so you hold that movement. And again back to this movement, and this time actually it's more for knee, so we don't move all the way up, and just up to knee. And so this completed the leg movement. And then we'll be going to the left leg, same movement, and the left arm, the same movement. And when we finish each extremities movement, then we will be doing the massage for the muscles. I will show this right thigh muscle first, since this is more easily to recognize. We will start moving this for the big muscle of the thigh. That this is quadriceps, of course, and then for the lower part, this will need a little bit of extra force, and then by flexing it, do this movement. This is like you will for massage for these muscles. This direction and then these directions. Usually when you first do, he will keep response and spasm, but after 2-3 minutes, then the muscle was softened. And that's the time you know it is done. And usually by this time the muscle will feel different. It becomes so soft. And that means it is done. Unfortunately, this part of muscle is atrophic, but we still need to grasp into it and do the same massage.
Could you do the lower leg again? This part.
Uh-huh. For the lower leg muscle, it is, you have to grasp in deep, since this is very small now. That. And you will be feeling, in fact, the muscle also get softened. And that's the time to stop. So average about 5 minutes-ish. So this completed the leg exercise. Now I have to go back for the arm muscle exercise. I did not try to massage his right arm here. So after finish ranging, should try to do this deltoid muscle. Grasp like this. And triceps and biceps. Have to be a little bit deeper massage. And this lower forearm muscle, this is the only muscle here that needs to be, and here. The movement of that movement actually is exercise this muscle. So when finish, I do this. And that completed the extremities. I will demonstrate again briefly the left extremities, including range and massage in one setting, and then we'll go to trunk. The range of motion of the upper extremities. First, use your left hand to support the left arm like this, and with the right hand to support the joint like this, and then start move the joint up to 90 degrees of the right shoulder joint. At the same time, the elbow also support us 90 degrees. This movement 20 to 30 times. After finish this, then again support the shoulder is important. Touch the forehead. Touch the forehead. Straight. Touch the forehead. Straight. Touch the forehead. Straight. It is very important. Use this right hand to support the joint so that he will not feel the pain and will not pull out and dislocate the joint. After this, then we'll be doing the elbow joint exercise. Again, support, straight, do this prone supine movement, and then stretch, 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 movement, and then we'll be going to the wrist joint, thumb to thumb, support, and then push 90 degrees, 90 degrees. Again, support is very important. And then make the fist of this hand, fist, straight, make the fist, straighten, fist, straighten. After this, then is the finger joint. Stretch, close, 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 stretch.
Go ahead.
Right? And then after finish this, then we'll start massage the muscle. Start with deltoid. This used to be very big muscle, and then triceps, massage, triceps. It is try to grasp in, and then biceps, and then brachioradialis. Brachioradialis. This is then this bigger muscle, the lower, the forearm is brachioradialis, brachioradialis, and the entire forearm muscle. And then the hand to complete the upper extremities. And then the lower extremities is a little bit complicated on the left side, since there is Foley catheter attached. Okay. When we do left lower extremities, because the catheter is here, so usually we do remember that we have to loosen the catheter first. But it's important not to loosen this part, so that when you move, it will not irritate the Foley too much, moving Foley too much. So this one should leave it on. That. And as you noticed, you should adjust the bed height in order to not to hurt your back. So keeps me in. That's it. Just a little bit. Again, when we arrange the lower extremities, again, stimulate it and let it kind of spasm a little bit first, and then start the hip joint, knee joint, and ankle joint movement. Again, think about walking, so it's flex like this, and go all the way. First few, there are lots of resistance, so usually you do it a little bit slower. Just a stretch. During this time, make sure your forehead is not stretching. Make sure. So after 2-3 movements, then you start to get loose, and then you continue to do about 30 times-ish until you feel the movement is loose. After this, then you do the ankle movement, which is again supported like this, and 90 degrees, 90 degrees, 90 degrees. Stretch, stretch. There. After that, 20-30 times, and then you do the knee movement. So as you notice, hip, jump down to ankle, and then do the knee movement. That's complete the range of motion, and then do the massages. Anterior group first. And then the side group. And then the back. If you still respond with spasm, that means it's not enough. You have to continue to do the massage until it feels softened. Now the muscle will feel much softer. The movement usually start with this, and this, and then come back to this. Usually by doing so, this muscle will feel soft, and that's the time to feel it is completed. And then go down to, so it's just mainly posterior group here, the gastrocnemius muscle. Yes, and that's should be enough since in front there's no muscle. And that's completed the extremities. 1, 2, to this is always at the lateral aspect of the thigh. Okay, and we are going to do the trunk. From the massage of the neck muscle, this to shoulder and neck muscle, the trapezius muscle here. Massage about 10 times. Again, it's very hard, but after this, you will feel softened, and that is the time. So usually about 10-15 times of squeezing. And that's the neck muscle. Now here comes what I consider is a very difficult and yet very important muscle to exercise this. It is important to massage this pectoralis muscle. Now, here, use 2 thumbs deep into this pectoralis muscle and actually dig into the armpit. Hold that to grab the whole muscle out and then massage. It's about 10 times, and you will be grabbing the muscle all the way, not just outside skin, muscle itself. You will feel it. Go and this way, no, this way, and this movement is very important, and you will feel
Starting now.
the massage of the pectoralis major muscle is important. It is using both thumb all the way to the chest wall, grasp this entire muscle and do this massage, and you have to feel the muscle each time stripped off the muscle, and then go little bit of pulling action, and in this thumb you will be feeling this tendon is here, it's very tight, and keep stretching. Stretch it, stretch it, stretch it. So 2 movement. One is to do that and do this movement to grasp the muscle. Now the second movement is this direction. Stretch it and to hook on this tendinous portion, the tight portion, and pull it, pull it, pull it. It's about 10 times-ish. So at the end you will see the skin usually turn red, especially this area. And that means it is complete. And then you go to do the left side pectoralis muscle. When you do that, as you notice, the arm should stretch out like that, and again go in, grasp it, move it, move it, move it, move it, and then next movement is stretch it, stretch it, stretch it, stretch it, stretch it, stretch it. Good. And that's completed his pectoralis muscle massage. After finishing this, we will be try to massage the intercostal muscles. the way of doing it. The rib, and between the rib, put our finger in between the ribs and do the circular movement. As you notice, with this stimulation, he always gets this spasm. That means we did the right thing. Stretch open, and do that. Opened, so, and this movement. So two movement. One is go along this massage movement, and then the other movement is circular movement. And if the hand, like me, is smaller, then I have to do two sections. One upper, and then go lower. So to finish this upper part, like that. And go all the way down to the lower part. See, again, that means it's the correct movement, and you stretch enough. That's why there's this reaction, kicking and jumping. That means it's very good, like that. Again, same movement. And that completed the chest and abdominal muscle massage. And we will be doing another movement when we are doing the bowel program. That's a different session. When we finish this, then one last and most important exercise is to practice and let him do the deep breathing exercise. Now this movement is you are going to do the massage of pectoralis muscle and then stretch the shoulder. At the same time, let him take the deep breath. So his head be toward the side and our head be toward this side. And do the circular movement first. 1, 2, 3. And then at the same time, he's taking deep breaths and hold it and breathe out. That's one exercise, one deep exercise. Second one, 1, 2, and 3. Breathe out. So by 3, actually you are pushing this bone, this clavicular bone, a little bit outwards. That's the way. We'll do 5 times of deep exercise. 1, 2, 3. Great. And 5 times totally. That complete the morning range motion. At the night time before sleep, we do exactly the same exercise. Thank you.
Good job. Good job. Good job.
What we would edit is sometimes that is the exercise of this. The morning time usually that's done, but the night time before sleep we would like to have Jonathan do his own active exercise. That is to exercise this forearms muscle. there. He has a very weak little muscle, seems still okay. So what we do is just to hold 90 degrees like that and let him try to move the arm this way. As you can see, actually he's moving and it did not, yes. And this exercise, he will be thinking about moving and also doing it. This can be do about 20 times. So that this movement actually working on one of these muscle, and in fact he is also doing this shoulder muscle to help out. This doesn't seems like any big movement, but if this continues, that muscle could get a little bit stronger. In fact, actually he's moving pretty much, about 20 times-ish, and that will be the additional exercise for the night time. And while he sits up, usually we'll let him do the muscle stretching exercise himself, and that will be included in separate session. Thank you.
Oh, good. Good job.
Okay.
That's a good job.
And then we probably should also do the dressings part of that. And sitting up, the position